Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Insight segment. I'm Harold Fisher. It's a Wellness Wednesday, and we are focusing on vitamins for your overall wellness journey, but not necessarily the kind you grab off the drugstore shelf. We're talking about IV hydration, vitamin infusions, even stem cell rejuvenation therapy. And my guests say these treatments are helpful for women's health and hormones, men's health and testosterone, weight loss, boosting energy, and more. So how is that possible? Well, my guests are from the Vitamin Suite at the Bowie Town Center in Bowie. Lakel Ebb is a registered nurse and the founder, and Dr. Mary Turner is a family nurse practitioner and the medical director. Ladies, thank you so much for joining me for this important conversation.
Thank you for having us, Harold.
Thanks for having us.
Sure thing. Let's first talk about what vitamin infusion is, because I think that in a lot of times in pop culture, we hear about people doing this, athletes, very, very busy people, people who are extremely active. But exactly how does it work?
Okay, I'll just go ahead and start. So vitamin infusions is pretty much the best way to get your vitamins immediately into the cells, into the bloodstream. The absorption rate for the vitamins is 100% when taking it by IV versus by taking it by mouth, which is in pill form. The difference is that it's 100% absorption by IV because it goes directly into the cell, whereas you take it by mouth, only 10 to 15% after it breaks down into your digestive system, it reaches the cell. Probably about 15% actually gets into the cell.
So how would that work, for example, and how and why would I choose a vitamin infusion over my one a day or my black and white macho man men's pills?
Well,
please go ahead.
You can go ahead, Mary.
Yeah. I mean, I think just to build on what Lakel said, you taking the medications by mouth, it just takes longer for you to get that support from the vitamins than it would getting an IV infusion. It's going directly to where it needs to go, and you have automatic access to it. Mm-hmm. So that's kind of the difference. I think you lose so much of the vitamins when you take them by mouth, whereas IV you retain them and they benefit you immediately.
When you say you lose, what do you mean you lose so much of the vitamins when you take it by mouth?
Urination. Sweat, depending on how much you're sweating outside or working out, you're losing that. You're not retaining that. So it's not going into the cell, it's coming off. You're like Lakel said, you're only getting like 10% of what you're taking.
Yeah, because I know, as you just said, Mary, that if I do take, one of those pills, and if you open up a bottle, they do have a smell. Not necessarily unpleasant, but they do have a rather distinctive smell. And if you're taking them daily, and however many you take, those horse pills and the like, at some point, during the urination process, you will know that what you've already taken is coming out.
Yes.
Yeah. So explain to me, if you can, some of the key benefits of infusions that perhaps people don't realize. Lakel, how does it work exactly?
So you're getting nutrients, natural vitamins and minerals that your body, we naturally have, right? But because of the lifestyle we live, the choices that we make, the food that we eat, we're intaking toxins on a daily basis. So it affects our cells. And so sometimes we need to supplement. So this would be a supplement to your regular diet or what you do on a daily basis, and replenish your body with the nutrients that we need to support a healthy lifestyle.
Mm-hmm. But if you, let us say, for example, if you already have a healthy lifestyle, and I'm not necessarily talking about elite athletes, for example, or people who work 30 hours a day, but if you are just yes, exactly, Mary. We do know those people.
Yes.
We definitely know those people. And but if you just kind of have a regular, lifestyle, and let's say you are a 30 or 35-year-old woman, how would you know that it is beneficial for you as opposed to what you're already doing, whether you're taking supplements by mouth or no supplements and getting your vitamins, naturally?
I would say you would experience an immediate effect. People after receiving an infusion, immediately your vitality, your energy goes up. Your skin looks different because of the hydration component as well as the nutrients that you're getting into the cells. You feel different. You do. And then that's one of the key benefits of getting it IV versus taking it by mouth, because most of the time when you're taking the vitamins by mouth, you don't see the difference in your health for about 15 to probably 30 days, right? You'll see the difference versus as getting it through the IV. You see it immediately. So to answer your questions, you'll experience the effects immediately.
So Mary, I'm sorry, please go ahead.
No, and for someone who's living a healthy lifestyle, it just enhances what they're doing. Exercise, nutrition, if they got it all right, checking the boxes, right? I don't know if that exists, but
you make a really important point there. Probably only a handful of people out of the broader population is eating right.
Yeah. But this just enhances it, makes it all better.
So Mary, who's a good candidate?
Anyone's a good candidate. I mean, we all on a daily basis, you wake up in the morning, you're not sure what's going to happen. So you can go without eating or out not drinking, or you can be that person who's getting up in the morning, having the protein shakes and, having a little lunch and then a nice dinner. Everybody would benefit from this. I mean, it just adds on to what you're eating or the lack of what you're eating. Everybody would benefit. And these IV infusions can be, you can cater to whatever that person needs, if it's antioxidants or if it's, vitamin D, vitamin C, those types of things can be added to these IV infusions to specialize for a particular person's shortcomings, what they're not getting out of their diet.
Interesting. Give me an example. So if I were to come to see you at the Vitamin Suite, how would I know what I need?
Labs.
Jump right in, ladies. Come on. You guys need a vitamin infusion too. Yeah. Jump right in, please.
Well, I don't know that you would know what you need. And just, but just when you interview a patient, you speak to a patient, you get an idea of what's been going on in your life. What type of work do you do? What's your diet look like? Do you take supplements at home? And you can see that. Are you fatigued? Is your skin dry? Are you losing your hair? Are you having stomach issues? Those types of things that you can say, okay, well, this is what you need. You need a immune booster, or you need just generally you went out last night and you just did a little bit too much and you need to have this hangover cure. So, those are things that we would get from speaking to the client.
I do want to talk about that, because that is how I first heard about the vitamin infusion thing, not only as relates to, to athletes, elite athletes, but also for people who have a tendency to, as they say, do the most, and in doing so, overexert themselves or party way too much. And as Mary was just saying, if you have a hangover, and that's a whole different conversation about how much you drank last night, and you should not have. But for those kinds of situations, and also there are the other kind of person who really kind of comes to mind for me are those who are in the entertainment industry, for example, comedians or people who are actors in live stage plays, when they are doing 2 plays every day, 6 days a week, or sometimes 8 or 9 days a week, when they are really, really kind of overexerting themselves. So, and if someone comes in, if I am one of those people, Lakel, and I come in, how do you run down the evaluation of how I know if this is indeed the kind of thing for me?
So initially, on anyone who receives that, being an IM injection, which is a quick shot, or a customized specialty drips, and hangover is one of those drips, you have to have what we call a good faith exam, where it's a telephonic visit with our nurse practitioner, and they'll do a thorough health assessment just to see if you're eligible for the drip. We like to get in your business, and that's one thing that makes us very unique and kind of sets us apart from other drip bars, because this is a nurse-led business, and we just got to assess. We just got to know what's going on with you before we can give you any type of treatment, because you may have, based on your medical history, some conditions that may limit certain things, fluid intake, maybe kidney disease, heart disease, and you may not be able to take in certain amounts of fluids. And so we like to look at that first and foremost. And then once we get that approval, we'll go ahead and decide, based on your symptoms, what drip is most important to you or appropriate for you during your visit. And you're right, that hangover drip is very popular. Especially with the college students and people. We're in the summer months, so there's festivals and parties going on around in the community.
Graduations.
Everything. And we're there to support that. So they'll normally call us the day after they feel the hangover, and they'll come in for the hangover drip. And that will help with recovery right away.
What is in a hangover drip, as you describe it?
So B vitamins, mostly B vitamins, magnesium to help, something to help with your nausea and vomiting, to kind of relieve those symptoms right away. A number of things to kind of bring individuals back up to normalcy.
And fluids, yeah, just the fluids is gonna help.
Yeah.
And that's, Mary, you just mentioned something also that I found to be very, very striking, because also we often hear with high profile people, we hear this a lot with actors and maybe even, older people who are very, very busy, and they are admitted to a hospital for dehydration. Is that also what we're talking about here?
Oh yeah, because you're going to get dehydrated if you're out, drinking, especially depending on what you're drinking. I mean, mixed drinks mixed with tea and things like that are already going to dehydrate you. You're going to add that to whatever you consume. Look at somebody who goes to the hospital because they've been having, vomiting or diarrhea for 24 hours, just even 24 hours. And that bag of fluid, you automatically feel so much better. You add the vitamins to it and all that you've lost, that's been depleted, and you're going to be like a new man or woman.
Interesting. I need to take a break, but before I do, I wanted to let our listeners know, if you want information about this process, you can find it online at thevitaminsuite.com. That's the Vitamin Suite, SUITE.com. And I'm sure they'll be more than happy to help you and give you some information. Going to take a quick break, but don't forget, you can hear this and every edition of the Daily Drum Insight segment via podcast on WHUR.com. The Original Quiet Storm with Raheem Devon is next on WHUR. This conversation continues on Sirius XM channel 141 and 96.3 HD2 in just a few seconds. Welcome back to the Daily Drum on Sirius XM channel 141. I'm Harold Fisher. We continue our Wellness Wednesday conversation about vitamin infusion. My guests are from the Vitamin Suite at the Bowie Town Center in Bowie. Lakel Ebb is a registered nurse and the founder, and Dr. Mary Turner is a family nurse practitioner and the medical director. I do want to go back to what we were talking about before the break, and something, Lakel, that you said about like, for example, a vitamin B injection. Is there a difference between a vitamin injection and infusion?
Yes. So the difference is that the infusion is intravascular, right? So we're putting a catheter into the vein, which is going directly into the bloodstream. Whereas the quick shot IM injection is an intramuscular shot, which it goes into the muscle. Also a good way to absorb. The difference is it's 100% when it goes through the vein versus going IM. It's about 90%, but very good absorption rates on both ends.
So here's the big question. For example, I don't have a problem with it, but a lot of people do not like
IVs.
Yeah, they do. And it's one thing, Mary, when you're talking about just a quick injection. Okay. But that IV thing is a completely different thing. Is it possible that if you have a phobia of needles, that this just is not for you? Or what do you tell people who are addressing or trying to address their issue with needles?
Well, I think from a standpoint of both of us have been ER nurses. You explain to them your experience in that, I had 22 years as an ER nurse. So, and then sometimes you tell them it's your first day and you both get a big, a nice laugh. But I'm going to start this IV. It's just about explaining to them what you're doing and that, it's just like getting a flu shot. You get a flu shot, you got a little prick. That's it. That's all you're going to feel. And then we're going to be done and we can move on to get you feeling better. The IM shots are great, but like Kel said, ultimately the IV infusions are what's going to have the patient feeling 100% better, quicker, I guess.
So
I will add.
Sure, go ahead.
I will add this as well. We do take in consideration that, they might not be able to stand the needle, or some people pass out from needles, but we will educate them on the absorption and how well it will affect them if they did it either way. I will say that in retail, we do offer vitamin patches and we do offer some pills as well if they prefer to receive their vitamins that way.
What is a vitamin patch? I've never heard of that before.
So one of the patches that we have and recently launched is our hangover patch, which I told you is very popular.
We have a recurring theme here. Maybe you should market your turn up patch or your turn down patch. But
yeah, that's great.
So it's our Vita Revive patch is what we call it, and what we do is we've been doing a lot of events in the community as well. Like I told you, there's a lot of wine festivals that are going on. And so we pitch a tent. We call it the Vita Hydration Tent because it's hot and people are drinking.
Yeah.
And so we're offering refreshments, water with electrolytes, as well as the hangover patch. And people are getting instant recovery right then and there on site. Like, I mean, I've been at an event, one of the clients was completely out of it. I mean, didn't know where he was. He said, when I did the assessment, he said he only had one shot of tequila. But he couldn't even speak to me. But then I put the patch on him in about 15 minutes tops. He was in his chair doing like this. He was like, I'm ready. I'm ready to go. I'm like, okay,
some more.
Ready to get back on the dance floor. But it does, that's one of the alternatives to getting the IV or taking the IM.
When you're talking about the IV, how long does it take for the process once you begin?
The process in getting an infusion is about 45 minutes, an hour tops. And that includes your assessment as well as getting the full drip.
Okay. One of the other things that I do remember seeing a few years ago when you're talking about concierge service, I guess that's what they call it. Do you all do those house calls and the like, or must they come to the Vitamin Suite in Bowie?
So right now we are accepting on-site visits in the center. House calls would be our next phase 2 to the business. We haven't launched that yet. Right now, the mobile piece of it would be our hydration station tent, where we pop up at these events and be on site to offer support.
So here's a really important question, and this relates to women and men. Are there certain things as it relates to the infusion of vitamins that, for let's say for women, are there some situations where you would not recommend it for women?
You mean like, so for women or for men, like Laquel started with before, if you have a history of congestive heart failure, things like that, kidney issues, you don't want to overflood the kidneys, the heart, those kind of things automatically, whether you're male or a female, are going to exclude that. Other than medically, I really can't. I mean, there's nothing in any of these IV infusions that you're not getting out of food, that you're not getting out of pills that you take by mouth. So they're not going to hurt you. Your absorption rate might be different for one person than it is for another, based on other issues that you have medically. But it's not gonna be treated any different for any male or female.
As it relates to energy, because as you know, everybody is tired.
Yeah. We were talking about that earlier.
Yeah.
You know, everyone is tired. Some people, after a good night's sleep, and they still wake up tired. And short of having perhaps some chronic ailment, but when you get a vitamin infusion, and I'm assuming, and correct me if I'm wrong, that each infusion may be tailored for a different person. It's not like a one-a-day vitamin. It's not one size fits all, is it?
No.
So, I mean, so how would you determine whether or not I need vitamin A, B, C, D, what have you? I mean, if I am, if I come in and I say, gosh, I'm just tired, and I slept for 9 hours last night, and I'm just feeling run down. I mean, how would you know what to give me?
So initially, going back to, what we mentioned before with the comprehensive assessment, just to see what's going on health-wise, we do have a component where we have a partnership with a company called Full Scripts that will do labs and give recommendations on what vitamins or supplements we could take. And one of the things that we will be launching too in phase 2 of the business is our own on-site wellness visits, telehealth visits, in which Mary will be spearheading, and we will be doing more lab requisitions and doing a comprehensive panel to do a more individualized approach for the vitamins and supplements. So that's coming in this fall.
So if I had a vitamin infusion, let's say today, on Wednesday, because I am feeling run down, and if I still keep that same extra busy schedule, how long should I expect to feel the effects of that vitamin infusion? Is it 1 day, 2, 3 days, a week? How do I, at what point would I need to come back if I'm keeping up with that very, very heavy schedule?
So pretty much, if you're pretty much healthy and this is just a wellness thing, you would do it once a month.
Oh, really?
Once a month. And if something else is going on where you are deficient and the doctor has said that your levels are low, which vitamin D, a lot of people are deficient in vitamin D, and they'll come in for an IM injection. That's IM. That's a weekly thing. But with the infusion, it's typically once a month. If something's going on chronically, it's twice at best. And then you can supplement other vitamins in between IM, depending on what's going on. It's customized. It's individualized.
Right. Yeah. And that's what I was speaking about before.
And I think you individualize it yourself, because depending on what you're doing after you've gotten the shot, if you're working more, then you're going to need it quicker than if you're, on vacation or, not really using those nutrients. So I think everybody individually, it's hard to say, well, you can't say everybody's going to come back in a month or everybody's going to come back twice a month. It's individualized to you and your intake also, and how you process that, and your diet, how you're getting from your diet also.
Yeah, because in my mind, I'm just thinking, for someone who may be feeling listless, tired, after this, they leave the center doing backflips with somersaults and
Yes.
and sticking. Really? Is it?
Yes.
Really?
So B12 injection is pretty popular
Yes.
to get the energy levels up and, support your weight loss journey by boosting the metabolism as well. A lot of people come in for that.
So talk to me about that, because as you know, one of the things that is all the rage is the I think it's called the GPL-1 injections, your Ozempics, your Wegovy's, and and the like. But we all know that weight loss is often tied to, as you just said, Lakel, to metabolism. So if someone is interested in weight loss and a boost to the metabolism, but what if they are on one of these weight loss drugs like Wegovy or Ozempic or what have you? What are the risks of a vitamin injection specifically for weight loss if you're also using those drugs?
There are none. Those drugs just kind of suppress your appetite. So the vitamins really that's not gonna affect the Wegovy or the Ozempic. You can get that in addition to that, because if your body's more copacetic, if your body is working, functioning better, then it will enhance the GLP-1s. if you're getting those vitamins and you're taking the Ozempic or Wegovy with them.
Mm-hmm. One of the other important things, and this is obviously for women of a certain age, those who may be experiencing, for example, perimenopause or going through menopause, may have issues regarding hormonal imbalances. What would you recommend for those, and what might be the effect?
Well, I think Nicole touched on this before. This is something that her and I are again working on, developing a protocol to have a telehealth visit with people that are going I won't say everybody. I guess some people are lucky, but perimenopause,
Not
menopause,
me, certainly, but
right? But you could talk about testosterone,
right.
Yeah.
So it's kind of like the same area. You have all of those other things, fatigue. You talk about fatigue a lot. The hormonal issues cause a lot of fatigue. They cause, appetite issues. They cause weight gain or sometimes weight loss. All of this involves going through and talking to the patient and determining, get some routine lab work, which is what we talked about. And then determining how best we can treat them. I mean, the IV infusions is great for any of those patients because you're only going to be able to build onto that. There's other things, other holistic things, the red light therapy, there's acupuncture, other alternative treatments that can go in addition to any kind of hormonal issues.
Mm-hmm. And you did talk about men specifically as it relates to its impact on testosterone.
Yes. Well, I mean, it's the same thing. It's very, I won't say the same thing, but it's very similar symptoms, fatigue, weight loss, decreased sex drive, all of these things. And testosterone is another thing that we're looking into offering the patients.
You mentioned red light therapy. What is that?
Oh, red light therapy. Ooh, one of the secret sauces to having that daily glow, right?
Mm-hmm.
So
Right.
So at the suite we have a full body bed, and with the red light therapy, it helps with decreasing the inflammation. It helps with muscle aches and pains. It helps with muscle recovery after a workout. It also helps boost collagen production in the skin, getting rid of the fine lines and wrinkles in the skin, which gives you that glow. As well, it also, my favorite part is it has a calming effect. So people suffering from seasonal depression, it boosts the serotonin and dopamine, and it gives you this zen, calm effect after having the treatment.
So how does it work?
So it's a full body bed. You get on it for about 20 minutes. It's a 20-minute session. Of course, after we do an assessment to kind of rule out any contraindications with phototherapy or any medications that you might be taking that have left you with a photosensitivity. And so 20-minute sessions, it helps boost your mitochondria, the mitochondria of the cell, which is the powerhouse of the cell that activates it, because as we age, the cells die off. And we need to activate those cells to detox, or get the toxins out of the cells and muscles. And so you do 20 minutes on that, and then you do 10 minutes on what we call a full body vibration plate. So you activate the cells on the bed, you get on the vibration plate for 10 minutes, you move out the cells, and then you excrete them. Of course, with this treatment, hydration is key. So you can opt into having IV after you do that as well, to help with the elimination of the toxins. And again, there's 3 ways to eliminate: sweat, urine, and bowel movements, of course.
So when you said red light therapy, I mean, is there are you holding a light bulb above the head? I mean, I don't know.
So to best describe it,
like a standing bed, right?
It looks like,
yeah.
Same kind of setup.
Although I'd like to see that. You should do that.
Yes.
Yeah, I mean, because I'm curious, because I don't know, and I think a lot of people, are wholly unfamiliar, with
Yeah.
these kinds of things. And, all jokes aside, when you said red light therapy, I was thinking less about a tanning bed
Mhm.
and more about a bed where you may have been handling some kind of wand that had a red light. So,
So there's different tools out there, a lot coming out, a lot more now than ever. You do have the handheld tools. You do have the face mask, which we do offer the face mask as well in retail for more of a targeted approach to your beauty regimen. However, the full body bed, you also have panels as well where people are standing in front of the panels. But we chose the full body bed because of the life frequency and the wavelengths penetrates the skin a lot deeper, which gives you the effects that you need to boost the cells or improve your health at a cellular level.
Interesting. One of the other things that I am particularly curious about, and you talked about the impact on someone's skin, and so would it be the vitamin infusion? Would it be the the red light therapy? What is best for someone's skin, generally speaking? And I'm sure that everyone is individual. Like you said, it really depends on the person's diet, their lifestyle. But as we get older, a lot of people are very concerned, obviously, about not looking older.
Yeah, so I would say we're kind of like a one-stop shop, and it's customized in that way so that it's the holistic approach, right? So you can get the red light therapy, which targets, again, the cells internally. The best way I describe that one is like the sun, right? We walk outside, the sun penetrates the skin. What do we know that we're getting from that? Vitamin D, right? So it's penetrating the skin to activate some of the minerals that we already have. But again, as we age, it's dying off. And so as we begin to activate these cells and get them going again, that's where we get back to our youthful self, the vitality, the energy, and frankly, the fine lines, the wrinkles, and getting that glow. And hydration just enhances that.
Yeah, got to be hydrated.
Yeah. One of the other things also about this is the summer right now. Do you change the kinds of vitamins that you may need if this is something that you were to do on a monthly basis or every other month or what have you? Well, if you do it every other month, 3 or 4 months, the seasons will have changed. And so are there vitamin infusions that are season specific? There may be more sun now, less in the winter. What do you say about that?
So I would say, as far as vitamins so the red light, right, would be
or either one, yeah.
Both. Okay, so I would say red light definitely during the winter months is a go-to because people are having like cabin fever. They're not getting enough sun.
Right.
The sun isn't out as much. They're not outside. So that would be something they would use. And also with some depression, seasonal depression. Again, it has that component that boosts your serotonin and dopamine to uplift your mood. As far as the vitamins go,
you're saying no, Mary?
I would say, irregardless as to what season you're in, I don't think the vitamins would change. Perhaps maybe the amount of times you would want to have it done might change. Like if you're very active and you're outside, you're sweating a lot, so you're losing all of that. So that might be something where you would have it more frequently than if it's wintertime, it's cold out, you're in the house, you're not really doing a lot of sweating, you're not, getting rid of those vitamins. So I don't think the seasons would change it other than enhance it depending on, how much you're sweating or getting rid of the vitamins.
Mm-hmm.
I would say,
go ahead.
I would say during the flu season, the immunity drip is quite popular.
Yes.
In the event that people might want to get more vitamin C to boost their immunity, that kind of thing. So they might readily go for that more frequently on your October to March.
Right.
Interesting. So now I have to ask the question that everybody wants to know. How much do these treatments cost? For example, your basic hangover drip, as you call it, the one that may take 45 minutes to an hour. What would be the price point for something like that? And would it be covered, if not by insurance? Would you be able to use a flexible spending? What do you say, Laquel?
Yeah, so the drips range from 170 to 220, depending on what drip you get. And the very basic would be the Myers cocktail, which is your basic vitamins and minerals. And then you get into more of the specialty drip, which the hangover drip is more specialized because you have additional additives with the vitamins to help you recover. And so that would be on the higher end, like 210. And then you can add on, depending on the person, right? One person might want a little bit more vitamin C. One person might want some glutathione to kind of help with the liver support, that kind of thing. And you just add on additional injections to that. And you can use, it's pay, out-of-pocket pay. And it's also, we use flex spending as well. And certain insurances will cover depending on if you have been diagnosed with a certain deficiency. So vitamin D is a popular one that everybody has, but you have to come in with your labs and some sort of justification from your doctor to determine if there is in fact a deficiency.
That's important to know. And what about the red light therapy?
Red light therapy as well can be covered under flex spending. It's private pay, and also some insurances will cover. But again, you need that diagnosis to justify the payment from insurance.
But how much would it cost?
Oh, typically red light therapy is $75 per session, which, that's 20 minutes on the bed, 10 minutes on the vibration plate, so 30 minutes in total for that. And we do have packages if you need it more often, where you're getting like 5 sessions for a package of $250, which makes it about $50 per session.
This is all really fascinating, although I'm sure that you would also recommend that those who may have, at a festival or something where they are feeling listless after ingesting too much alcohol, not to do this so you can just go right back out and start drinking again. I mean,
you got to pre-plan. You got to schedule the appointment, and then because you already know when you're going. Well, most people know when they're going, and pre-plan that, like knowing, hey, all right, I'm going to go see Laquel on Monday because over the weekend I know what I'm going to be doing. So you got to be planners.
That's the smart drinker. Yep.
Right.
Yeah. Oh my goodness, ladies, you have been so informative, and I also appreciate your humor as well. And thank you so much for spending some time with us.
Thank you for having us.
Thank you. It was awesome.
Laquel Ebb and Dr. Mary Turner of the Vitamin Suite at the Bowie Town Center. Thank you so much. That is the Daily Drum for this Wednesday, August 6th. I'm Harold Fisher.